Yeah.
Afternoon.
Good afternoon.
How's everybody?
Wishing we were at the lake. Wishing we were at the
You
lake.
can come on, go home with me.
Hey, in about 5 hours, I'm gonna be there.
Okay.
But I'd like to welcome each of you to the commission meeting today. It's an honor and pleasure to see each of you. Look forward to this every month. So I'm officially calling the meeting to order at 3:01 p.m. Today, Thursday, April 24th. And Jeremy, if you would be so kind to do roll call.
Here. Mr. Walters. Mr. Griffith has requested to be online. He joined us. Mr. Griffith, are you there?
Yes, sir.
Nicely let us know that you would not be able to make it today. Mr. LaRue. Ms. White. Mr. Billy Martin.
Here, sir.
Mr. Collins. Mr. Specs. Mr. Carter. Chair Smith.
Yes, present.
Mr. Sandy. Here. Mr. Dean Martin.
Here.
Mr. North. Yeah,
He did.
Williamsburg. Mr. Osborne.
Present.
Ms. Shepherd. Mr. Dressler. Mr. Carson. Mr. Volleson. Here. Ms. Erdman.
Here.
Vice Mayor McGuire. Here. Ms. Dirk.
Here.
Vice Mayor Green.
There.
Mr. Holliday. Here. Ms. King.
Here.
Ms. Loudermilk.
Here.
Mr. Unruh. Mr. Wood. Mr. Clements. Mayor Gross. And Mr. Peters. We have a quorum. Madam Chair.
Thank you so much, Mr. Holmes. Before we get into the body of our agenda, we need to take care of two action items, if it be your pleasure. The first of which is we have to do a motion to allow Mr. Griffith to participate virtually with our meeting. So there you go. All those in favor say aye. Y'all done this before, haven't you? Okay, so I don't need to read all that. Very good. Welcome, Mr. Griffith. We're so pleased to have you with us. The second matter that we have is I need to entertain a motion to amend the agenda to remove item number 6.
Oops.
Bill, thank you, Bill.
I'm sorry.
Y'all just keep it coming. I would like to have a second. Thank you. All those in favor, please say aye. Aye, like sign. Okay, and that carries unanimously. And we'll talk about item 6. Basically, I was just going to make it under my remarks, but Senator Head is not able to be with us, so we have Carrie Sheffield with us, and we'll talk with Carrie in just a few minutes. Okay, so the next item on the agenda is your consent agenda items consisting of the agenda approval minutes, financial reports. Are there any questions, concerns that you have on these documents? Okay, hearing none, I'll entertain a motion to approve the consent agenda items as presented. All right, all those in favor, please say aye. All those opposed, like sign. Okay, and that carries as well. Now I'll offer a few remarks, under chairman's remarks, if I may. First of all, let me get my grip here. I have so many notes. Gosh. We need to appoint or reconvene, rather, I would say, the nominating committee for the commission. And the rationale for this, if you will recall, is back in January, when Mr. Wallace went off of the commission board. I was vice chair at the time, and the commission allowed me to step up into the chair role, and Mr. Wallace took the vice chair role. So what we need to do is, I need a motion to reconvene the nominating committee that we have seated, to take this matter up for the chair and vice chair to be formally appointed for their 2-year terms, to begin commencing, we believe, July 1st of this year. So is there a motion to reconvene the nominating committee? Thank you. Is there a second?
Second.
Thank you. All those in favor,
Can
please.
you refresh us as to who was on the nominating committee?
It
Catch you by
was,
surprise?
yeah.
You looked at me Lee, when you said that.
Mr. Holliday, Mr. North, Mr. Volleson, I'm drawing a blank, I think it was, Ms. Smith, I think if you wouldn't mind.
I'm on everything.
If you wouldn't mind, Chair, Madam Chair, if I could see that, the email, I think.
Yes.
There may be one other name I'm missing, it should be better for, Mr. Griffith, and Mayor Gross.
Want to know who we were.
Yeah.
Sure. So, did we?
You have a motion and a second.
Yeah, motion and a second. So all those in favor of reconvening, please say aye. All those opposed, like sign. Okay, thank you all. Thank you all for facilitating this process. We have these bumps in the road, as you all know, with elections, so, and we remain very grateful for Mr. Wallace. The other thing that we have, this is, Ms. Sheffield is here from Senator Head's office. Would you like to, just kind of stand up and introduce?
My name is Terry Sheffield. I joined Senator Hutt's office January 16th, and I came from Senator Bryce Reeves' office previously. So I just recently moved here with my 5 kids from the city of Fredericksburg. So happy to be here and happy to learn all about all of the great things you're doing.
Well, we really appreciate you being here today. What we have kind of thought about, you're new and getting your feet wet, I'm sure,
Yes.
drinking from a fire hose, some, as I like to refer to it. What I'm thinking for the commission's purposes is at the end of the meeting, when we get to other matters, comments by supervisors, commissioners, that if you would be willing to take some questions, answers, or comments, then in addition to after the meeting as well. But we've got to be kind and provide her a lot of grace because she is new.
Absolutely.
Yeah.
And if I don't know the answers, I will take it back to the senator and get back with you.
Well, you were so glad to have you. Thank you for
Thank
being,
you.
you're brave. Thank you so much. Okay, a couple other funding updates. The commission is pleased to have been awarded funding from the Virginia Department of Environmental Quality to support our water supply planning for the Upper James River 2 and Roanoke River 1 planning regions. In addition, the commission was awarded $85,000 community conservation grant to continue our septic pump out work. Staff members Amanda McGee and Tara Baumuliner have worked hard on these grants, and we want to congratulate them. The commission's strategic plan kickoff meeting with the executive committee is due to be held on May 7th with our staff directors. The consultants will be developing surveys. I think you've probably seen those perhaps on your email, that you've already gotten those. And to execute those, to give the consultants some baseline information. There's also going to be, of course, opportunities for the commission members to interact directly with the consultants as we move through the strategic planning evaluation process. I think that's very important. Surveys are not going to cut it. And just with my experience, we need to have some face-to-face interaction with the consultants as we plan and strategize our future. Also, the Federal Reserve Bank of Richmond is hosting the 2025 Investing in Rural America Conference at Hotel Roanoke, May 20th and 21st. We will have several commission staff in attendance for that event. If you are interested, you can talk to Virginia. She'd be happy to facilitate registration for you. And I believe that's the extent of my remarks. Am I missing anything,
I believe that's it.
Jeremy?
Sure.
Okay, so does anybody have any questions regarding some of the things I've just reported out to you? Things are moving along well, getting a lot of things done, and got some things I'm sure Jeremy is going to report on here next on our agenda, if you would, Jeremy.
Thank you, Madam Chair. Just a couple of quick notes. Just to share, I, along with many of you, were at the Regional Chambers Legislative Wrap-Up earlier this week. I talked to Ms. King after the wrap-up. Having attended that, I wanted to sort of emphasize the extent to which our legislative delegation talked about how important their work regionally was in advocating successfully for the region. We had 9 folks up there representing urban areas, rural areas. We had multiple parties represented. And they consistently talked about the competitive advantage to which our region has in Richmond compared to others because of their emphasis on working together and building regional legislative agendas for Richmond. So we're continuing to work on our own regional legislative agenda. I think it emphasizes that it's been a great time for us to start that work. We're about to enter the third round of that. We look forward to your input as we develop that. You will no doubt be hearing from Mr. North as chair of that committee and those members in the coming weeks. But I thought it was very well aligned that we have begun that regional work, and we're seeing consistently that message from our legislative delegation, how important this is. And I've said it already, but I'll say it again. They have specifically noted that other regions don't work together as well, and that puts them at a disadvantage in a increasingly difficult legislative environment in the General Assembly. So I appreciate all the work that you do to support the Regional Commission, your work as commissioners, and your work to support our growing legislative efforts. Several of you were here a little earlier during the TPO, and some of you just before that. Oh,
Will
yes,
you
sir.
take questions during your report?
Absolutely. Yeah.
Okay. So this is a relatively new effort, and I guess it started at the commission level and not at TPO.
Correct.
But Mr. North was clearly a big proponent of it. I'm just curious as to whether it makes sense. We used to have more efforts for outreach with Western Piedmont and the New River Valley. Occasionally had a joint meeting and things, and we really aren't seeing as much of that now, even though certainly with the New River Valley and probably with Western Piedmont as well, we actually have more in common, I think, now than we used to, which maybe is why we had to have those meetings.
Mhm.
My point simply was that because we have representation from Franklin County on this commission, I'm just curious if it makes sense to extend our this legislative effort to, if it would work, to make it a broader regional effort.
Yeah.
And or at least explore that possibility.
I think that's certainly something for the legislative committee to consider. I know there's, you're right, and now that I think about it, we did a lot more sort of joint meetings or kind of formal things with our neighboring planning districts. That's still happening, but it's a lot more behind the scenes. We've got, for example, tomorrow I'm meeting with West Piedmont and Central Virginia to talk about Route 122 and some Franklin County and Bedford issues and so forth, but we haven't brought it to necessarily those conversations to this body. But I think that's a good idea. Most of those legislative issues overlap, and when we start talking to one delegate there, Bill Stanley, for example, is Franklin County and down into far southern Virginia. So there's good reasons to have those conversations. When we started this, you might remember, we did a lot of outreach to the other planning districts about what do they do with legislative, and some of them are more or less comfortable or interested based on their own boards and getting involved in legislative advocacy in the way that we have started. So that might have also played into a little bit of West Piedmont and New River, Central Virginia's sort of interest. But I think it'd be a good idea to revisit that now that we're 3 years in and we've got some of those relationships going from that outreach.
And also the legislative districts don't.
Right.
They don't have any rivalries.
Right.
Mr. Osborne, thank you for bringing that up. I like that very much. And between Jeremy and I, we will make sure that Mr. North is aware, because I think that outreach, we probably need to facilitate sooner than later. Because believe it or not, this committee's gonna get started within the next few months. Try to solicit legislative issues. But thank you for bringing that up. I think that's a great thing. I know Franklin County, bringing in West Piedmont. That is going to be really important. Just some of the things you mentioned 122. And so I think that, being able to leverage these more regional issues with the right stakeholders at the table, I think it's going to be very intuitive to us as we move forward. So thank you.
It also makes sense with this brick initiative.
Yes.
For us to be talking to those areas more as well.
Yeah, that's a good point.
Yeah.
Well, and that's an excellent segue, Mr. Lawson. I'm about to talk about, we earlier today met with Greg Campbell, the director of the Virginia Department of Aviation. He spoke at the TPO. Previous to that, the group that we've spoken about that's been working specifically on airport issues, we drove a group of them down to Raleigh to meet with their airport folks. We met with Mr. Campbell and we met with the representative of the BRIC to get a little bit more information about how to better engage with the state Department of Aviation on ways to support the airport. I think we know that just having Mr. Campbell at the TPO was new. We've never had a representative from Virginia's aviation department at the TPO, despite the representative airport on the TPO forever. So we're making additional efforts, and I think one of the highlights of that was that Mr. Campbell said that we are far ahead of where other regions undertaking similar work are in terms of advocating, in terms of building private sector and the right kinds of stakeholders to support the outreach that we need to do to lift up the airport. And mentioned a number of times that amongst national non-hub airports, Roanoke ranks probably in the top 10 on a number of services and connectivity and other issues, which was just a good reinforcement of that. Part of where we start with this is appreciating and understanding what we have as we do better at advocating for more. So I just wanted to share that. We will have Mr. Campbell back in the future. He's very excited to be here.
You guys on commission staff are so proactive. And I've noticed that a long time. You really are. You work hard, your people work hard. And that helps with the success of this organization. And of course, the rest of the people in here too, the members of the commission.
Thank you. Thank you, Mr. Martin. And remarkably, that's another excellent segue to it's like you had a script. I do want to take a moment, speaking of excellent service, this week, we recognized Administrative Professionals Day. And I want to take a moment. All of you know and love Virginia Mullen.
Yes.
You probably talked to Virginia, received more communication from Virginia than you do from me. Probably 2 years, unless you're Chair Smith, who is tired of my emails. But I do want to, I want to take a moment to recognize that all the hard work and service that Virginia put. Just what she is doing right here that stops me from having to do what she is doing right here to keep this meeting going and to make sure that we do everything right is remarkable. So thank you, Virginia.
Thank you.
And thank you, Mr. Martin, for providing me a good intro. And that
Yes, sir.
is all I got to say.
I was remiss that, I'm sorry, Barbara.
Mr. Holmes, you mentioned the work that you're doing, and then Mr. Osborne suggests the Piedmont Planning Commission. I would suggest too that in the New River Planning Commission, that we involve them in our legislative issues. Southwest Virginia is an area that needs representative.
I actually mentioned them.
The BRIC, the Blue Ridge Innovation Corridor Initiative that Mr. Mollison mentioned specifically is trying to better tie New River, Roanoke, and West Piedmont and on 220 airport issues. So that definitely in the radar to improve those relationships.
Anybody have any questions for Mr. Holmes? Anything you reported on? Now's your chance.
I was gonna say it later, but I'll say it now. So, about the CTV meeting and potential comments, speaking of legislative issues, so the importance of the 220 corridor. If you're gonna be there to speak to that or chair maybe there as
Oh, I'll
well.
be there with bells on. Oh, yeah. Yeah, that's May 7th,
14th.
14th at 4 p.m. at the Holiday Inn at Valley View. Is that correct?
It's right off of Hirschberger.
Yeah. That is, if you've never been to a CTV hearing, I find them to be very helpful. If I'm setting up there at the dais, we will have Dr. Smoot there. But it is such a good environment to talk about transportation issues for our areas. And you just feel in the room the compassion and empathy for what we're going through within our own jurisdictional areas. So please don't hesitate to think about going and signing up to speak. You have a lot of power in your respective roles, and the CTB needs to hear from you because they do listen. And I don't view this as an arbitrary thing to, have to spend your time. So I highly recommend you take advantage of that opportunity.
Two other,
The date and time.
May 14th,
Okay.
4 o'clock. At the Holiday Inn at Valley View, I believe. Go ahead, Mr.
I
Singh.
was gonna say, two other points I think that are very important to this group is the secondary road funding or lack thereof.
Yes.
And the other would be smart scale and just kind of the observation, or maybe it's just me, but the observation that it's less friendly to rural localities every time it incrementally changes.
Yes.
So again, I don't know if there's certain talking points, but I think those are three I think that from the region are important.
Well, on that note, we will have probably a speaker from the TPO and a speaker from the commission, so we can take those, but if any other commissioners have anything that you would like us to highlight from staff that particularly impacts your role in sort of the regional transportation network, please feel free to email me those and we'll collect those. But certainly those are things we'll include. Mr. Robertson and I will do our best to divide and conquer. And so they'll have multiple presences from a regional perspective.
Barbara will be there with her bike to speak to the biking.
Mr. North
Yes.
will be the second person signed up to speak that
Right.
afternoon as usual. So we'll have a strong regional perspective there, but we'll certainly, if there's anything you want to make sure that we cover that has a direct impact on your localities, then please let me know. We'll incorporate those into our.
Well, and I would add to that, Jeremy, that even though you sit on this commission and we will have a voice as a commission at the CTB, don't lose fact that you may choose and desire to advocate on behalf of your locality, which is leveraged really in large part by the commission disposition as well. So, and if there are issues, and I know we share a lot of commonality, and you feel like you want some talking points, we will help you with that as well. So just let us know that, if you really want, sometimes we, for me, I don't know, at least with me, sometimes I want to talk about things, but sometimes just having some data points, it gives you confidence in going up to try to speak about the needs. So, just keep us, in mind and let us know how we can support you. Okay, Mr. Sandy, thank you for bringing those items up. Okay, we are going to move on. This afternoon, we are very, very honored to have Dr. Cynthia Morrow with us. Cynthia is the district director for the Roanoke City and Allegheny Health Districts, as well as the pilot regional director for Southwest Virginia. Prior to moving to Roanoke in 2017, she served as the commissioner of health for, okay, I'm gonna try to get this right, Cynthia, Onondaga County in New York, and Lerner Chair for Public Health Promotion at the Maxwell School, Syracuse University. She is a consulting editor for the Journal of Public Health Management and Practice, and is the co-author or co-editor on 5 public health textbooks. Dr. Morrow earned a bachelor's degree in psychobiology from Swarthmore College and a combined MD, MPH from Tufts University School of Medicine in Boston. She completed her residency in internal medicine at the Medical University of South Carolina. So I hope that I've done you well, Dr. Morrow, and we welcome you. You're welcome.
What's best for you guys?
I would say to present at the podium, if
Yeah.
you will.
And is there a clicker?
Is the clicker up there?
Thank you so much.
We're so privileged to have you with us. Thank you.
Thanks for having me. So talking about data points, I probably have too many data points. So in public health, we try to meet people where they are, and we might be talking about a little bit of ROI here or there, probably too much, in hindsight. But I want to say thank you to Mr. Holmes for having me. We have worked together on a couple of different things, and the reality is that the communities that we serve overlap so significantly, and a lot of the issues that we address overlap significantly. So, local public health, we are what we do. What I wanted to emphasize here is that my job is to protect the community's health, but in protecting the community's health, it's also a way that we protect the economy. Now, I was telling Mr. Holmes that, my father was probably the most brilliant man I've ever met. He started out as an economist. And he ended up as a physician because he learned that the only way to have a healthy economy is to have a healthy people. And having a healthy people pushes, it's a bi-directional. You can't have a healthy economy without healthy people, and you can't have healthy people without having a healthy economy. So I learned that from a very early age, and that's definitely something that influenced my going into medicine. So who we are. We basically serve the same area except Franklin, and in my role as regional, I'm also covering Franklin. In addition, West Piedmont has an amazing new health director, Penny Hall, and she and I talk every 2 weeks on a formal basis and more frequently on an informal basis as I try to help her in her new position as the district director. But what I wanted to focus on is the shared goals that we have. Your primary area is in enhancing transportation networks, bolstering economic progress, and ensuring environmental sustainability. So I hear about these grants, these water grants. Well, gosh, we're the Hippocrates age of don't ever have your waste near your drinking water, right? Like Hippocrates knew never to have your toilets near your wells. And so we do that in local public health. We make sure that happens all the time. And then from a disclaimer or not a conflict of interest, but to just be transparent, I am on the advisory committee of the collective response, which of course is the host here. And so I want to be very transparent about that. So public health, there are 3 core functions of public health. The first is assessment. It is our job to assess the health of the communities that we serve. The second job is policy and service. It's policy development, but it's the provision of services to ensure that we're meeting those needs that we find in our assessment. And then assurance is the other thing that we do. And so we act as the safety net. So the safety net in Covington and Craig might look very different from the safety net in Roanoke City, just because of the different service providers that are available. And as part of the assessment, one of the things that we do is we want to make sure that we understand where all of our localities are. One of the tools that anybody has anywhere in the United States is access to this thing called the County Health Rankings, and now it's called the County Health Rankings and Road Maps model. And in this model, you can go and learn about the health of any community in the United States. And it's based on the physical environment. So housing and transit is right in there. Social and economic factors, clinical care, behavioral health, health behaviors, and ultimately how those all impact the health of the community. And what I want to focus here is policies and programs are at the absolute foundation of all of this. And so that's where I think that at the end of this, what I just want you to know is that my job is to serve you and the communities that you serve. And that's same for Penny Hall and West Piedmont. But the reason I wanted to share this is that we look, at the health of Virginia. And so the county health rankings allow us to see how different communities are doing. And I don't think it's any surprise to anybody that far southwest ranks far lower than northern Virginia. And if we look specifically at the communities that we serve, you can see that Roanoke City and Covington City are our least healthy communities. And I think we can all understand some root causes behind why these are our least healthy communities. And our job together is to lift all the boats. We want to make sure that all of our communities are in this dark green. So diving a little bit deeper, if we look at Covington, so of the communities that we collectively serve, Covington has is the least healthy of our communities. And I wanted to point this out because this is, there are lots and lots of different ways of looking at the health of a community. But for me, one of the most important ways is looking at potential life lost. And if we look at Covington, this is Virginia and the United States, and this is Covington. It's remarkable how much work we have to do in Covington. And if we look at the primary, so the years of potential life loss capture those premature deaths, those deaths of individuals who might be dying from an unsafe sleep environment or from substance use disorder. The people who had lost a lot of life because they died too early. And if we look at where we are in terms of years of potential life lost across the country, unintentional injuries, which includes substance use disorder, is at the top of that list. Versus if we look at what is the leading cause of death in the United States, what's the leading cause of death in the United States? Heart disease? Yeah, so collectively heart disease followed by carcinoma. Now, Roanoke County, now, Botetourt usually edges out Roanoke County in the rankings. They have changed it so that, but this past year, you guys were neck and neck. So in contrast, if we look at Roanoke County, and I could easily put Botetourt up here, but Roanoke County edged up Botetourt just a hair this year. We can see that it's a much healthier community. And the work that you guys do is part of the reason why it's a healthier community. So what are we doing? What can we, the health department, do for the communities that you serve, for the communities that are represented by the regional commission, by all of you commissioners, the work that you do? These are we do a lot. And I'm not going to go through everything. I'm picking and choosing a few things. We have an annual report. One of the things that I think is critically important is transparency. So every year we produce an annual report so that your taxpayers can look at what we do and what services we provide. So I'm not going to go through all of it, but I'm going to provide you a few things. So for case management, elevated lead levels, totally about the infrastructure. We don't talk a lot about it, but last year we managed about 100 cases of elevated lead. We know based on studies that for every dollar invested in lead abatement, we see a $17 return. That's based on a study that's a little bit old, it's about 10 years old. But that information is ongoing. For family planning services, we provided more than 2,400 services, family planning related services. These are global statistics. They really don't translate well to the United States. We don't have a lot of information on ROI in the United States, but globally, a dollar invested in family planning results in $60 to $100 in savings. Immunizations, I'm going to talk about on the next slide. Long-term care screening, we provide this essential service with our Medicaid colleagues. Newcomer health, we welcome refugees who are through the official refugee resettlement process. Immunizations, we all know that immunizations work. We have seen a significant decrease in immunizations and baseline immunization rates since the COVID pandemic. We provided over 7,000 immunizations within the health departments last year. But I wanted to just point out that we all know that there's a massive measles outbreak going on right now. Virginia had its first case related to this new outbreak reported last week. The ROI on immunizations is insane. And these are all of the different ways that you can measure the economic impact of immunizations. And I'm happy to share these slides. Well, you have them. You're more than free to share them. But this is just an example of what our society is at risk when we don't optimize our vaccine rates. Our measles vaccines have gone down, and I don't think that anyone is questioning that part of the reason this outbreak is as big as it is because vaccination rates have decreased. One of the things I also want to point out is that home visitation, if I could wave a magic wand, I would ensure that every pregnant woman has access to home visitation services, because we know that the ROI on some of the evidence-based home visitation services is 1 to 9. Really amazing. It depends on the services, but just locally here in the Roanoke Valley, here are some outcomes from 1 year of data for CHIP of Roanoke Valley. I'm not going to go through all of them, but if you just look at this one, a 40% reduction in preterm birth rates, saving roughly $30,000 per birth. Roanoke County has one of the highest infant mortality rates in the state. And almost exclusively, I know it doesn't make sense. We're looking at it, it doesn't make sense. It's the overwhelming contributing factor is extreme premature births. So we have to prevent those premature births. And one of the best ways to do that is to ensure access to prenatal care and home visitation services. Early intervention, every child in the United States under the Federal Individuals with Disabilities Education Act, the IDEA Act, every child who is identified as potentially having a developmental delay is entitled to a full developmental assessment and the services that he or she needs if they qualify for services. And so we're unusual. We in Central Virginia are the only 2 health districts in the state that administer the early intervention program. Typically, it's through the community service boards, but we do that here in the Roanoke Valley. In Alleghany and Covington, it's their CSB that does early intervention. Emergency preparedness. We saved over $40,000 last year in volunteer work through our medical research. Oh, and at airports, we work with the airport to do their work. They have to do emergency drills, and so we partner with them to do their emergency drills. Environmental health. I'm going to be meeting with Habitat on Tuesday. So we're going to talk a little bit about some of the things that we're seeing in our on-site program. But we can't develop in Roanoke County and the emerging restaurants. They all need to be permitted. They all need to be inspected. So that's what we're going to do, because we need to assure restaurant food is safe. We don't do grocery stores or anything like that. And then wastewater. We are out there making sure that the developments have the resources that they need, whether it's public sewer or wells. We're going to make sure that we can work with them to do the right thing for the community in terms of development. And then I did want to spend some time on substance use disorder, partly because the collective response is housed here, partly because a lot of OAA money is coming into all of our communities. And we really need to ensure that we're optimally leveraging those resources. So have you guys seen this dashboard? So this is a Virginia dashboard on the cost of opioids in Virginia by every locality. So if we look, Roanoke City, is disproportionately impacted. So if we look at 2024 data, 1,500 per capita cost in substance use disorder costs. Some of them are direct costs, but you can break it down further by labor, healthcare, crime. So it takes into account all of societal's costs. So I encourage you to consider that, because for every dollar we invest in preventing substance use disorder and in managing substance use disorder, we're saving dollars that could otherwise be invested in the work that is so important, transportation and building businesses. And here's a breakdown of where the costs are incurred. This is all publicly available data. The link is in there. So again, you're more than welcome to look at it. And then what I wanted to share is the collective response, OAA. If we look at just last year, we had a 25 to 35% decrease in overdose fatalities in Roanoke City. Now we're seeing decreases across the entire country. But the work that is done right here with collective response, with all of the community partners, has ensured that we are having a disproportionately positive impact on substance use disorder in the last 2 years. So when the 2024 numbers, I think they just come out or they're coming out because we get previews, so I can't remember if they've been publicly released or not, are going to show even further decline. Really remarkable work. And this is just what we, the health department, have done. We've distributed last year, over 1,700 fentanyl test strips. We trained 800 people, in, Revive. These are just distributed over 900 doses of naloxone, and that's just us. That's not all of the partners. So the work that is being done is making a difference, and it's saving us lives and dollars. And then the Women's Infants Children's Program, these again, just the highlights. I wanted to point this out because every day we serve hundreds of families across all of the areas that you serve. And the return on investment, again, is pretty remarkable. It's a guaranteed outcome when we encourage people to participate in WIC. I just want to share one more anecdotal story. We had a situation last month where we identified, and I'm looking at my Franklin County colleagues, we identified 2 individuals who had an invasive disease called meningococcal meningitis. It's got a very high fatality rate. Unfortunately, we lost one of our residents to it. But the individuals worked in a business in Franklin County. And we worked closely with West Piedmont Health District to ensure that everybody who worked in that business received post-exposure antibiotics. And then once we were able, this is a bit technical, but to serotype the type of Neisseria so that we could make sure that we were offering the right vaccine, because they're 2 different vaccines. We worked with the West Piedmont District to vaccinate over 100 people in this business to protect them. And it's just an example of how together we can make sure that we're protecting health and protecting our economies. And so really this is just, we're here to serve the same populations, the same businesses, the same economies. And anything that we can do, and I know I speak for Penny, anything that we can do to support your efforts, water grants, anything that we can do to partner with you, we would be honored to do so. So I'm happy to take any questions. I think Charlie, if you wanna. So sorry, I used your first names.
Dr. Marche, this has been very eye-opening and insightful. So I'll open up the floor to questions, comments from commissioners.
I just have one thing. I noticed I think at the news this morning, that the air quality in the Roanoke Valley has gone down. And I thought, what in the world have we done? And they said that it appears to be fire particulates.
Yeah.
From all of the, unfortunately.
Yes, so there is air quality, and I am not an air quality expert, although I will say, given the situation in Covington, I think probably some of you have heard about, Mr. Holmes and I were just talking about it. I learned a lot about air quality in the last few months. Air quality is an issue in a lot of places relative to suburban and urban places. We're actually doing well. The forest fires that we've had have absolutely contributed. There's no question about that. That hopefully it's episodic, it'll go away. Whereas in some places where they're really high, there's really high volume of industry and cars. Cars are the greatest consistent source of for indoor or for outdoor air quality. I will tell you that is everybody familiar with the situation in Covington? Not, some people are. So there was a situation in a middle school, there was a concern of carbon monoxide. In hindsight, we identified that there is a community-wide increase in carboxyhemoglobin, which is the hemoglobin that we use to measure exposure to carbon monoxide. Because of that, We did a really deep dive with DEQ. You mentioned DEQ earlier, Department of Environmental Quality, to try to understand air quality issues. It is not, the carbon monoxide has nothing to do with the school, absolutely nothing to do with the school. But we looked at industry, right? Is industry contributing to it? We do not believe that that's a significant factor. So I think that the reassuring thing is that we have a Department of Environmental Quality that's not VDH, but it is a Department of Environmental Quality that spends every day researching things like air quality. And so it was very reassuring. I learned a lot in that process. So hopefully that's a little bit reassuring.
Got a question. What was the end result of Franklin County? Were you all able to stop the spread, or and the two people that had it, have they recovered, and is that,
Neisseria meningitidis is a pretty rare disease. We only see like 360 cases a year in the entire country. So to have two in the same week in the same population is honestly unheard of. So it would be really hard for us to tell if it's spread because it happens so rarely. But what we do know is that by working with them, we were able to protect everybody in that industry that wanted to be protected. And we have full confidence that this vaccine is very, very effective. So, but we did lose one person. One of the people did not survive,
okay,
which was heartbreaking.
thank you.
Yeah, absolutely.
Does the valley have monitors for small particulate matter?
I'd have to defer. I don't know. I will tell you that when we did the carbon monoxide, there's no carbon monoxide testing anywhere in our area. There's some in West Virginia and Virginia Beach. But I did not ask about small particulate. I'd have to ask DEQ, and I can ask them if that would be
Would
helpful.
you? I appreciate it.
Sure. It's probably on the web. I'll find that.
I'm not sure I can remember the details very well, but this whole region was subject to air quality restrictions, if that's the right way to describe it. Meaning that, we were testing at a level where, there were concerns that, and it's exactly what you said, it's a combination of traffic and coal-fired power plants and that kind of thing, burning going on. But we have, all the localities in the regional commission got together and they agreed to a plan to sort of try to address those problems. And we were, as far as I know, we were successful. Now, I don't know if we know why we were successful. In other words, if there was a direct correlation to what the plan was to what the outcome was, but the particulate, levels got to a point where we were no longer in violation of the.
Yeah, and
Can you
yeah,
amplify
I'll
or explain better than I can?
I don't recall to what extent that program might have interacted with VDH. So what we were actually in danger of emission was ozone.
Okay.
So ozone pollution between truck traffic on 81, weather patterns bringing coal-fired power plant pollution in, Roanoke cement. There were a couple of very specific point sources. Some of those were, traffic, they did change diesel engines, and that had a big part to do with it. They closed some power plants. So that has brought ozone within acceptable levels. Particulate matter, on the other hand, we weren't being dinged for particulates. We were being dinged for ozone. Particulate matter pollution has not changed significantly. One of the big issues with ozone was it's a huge summer problem because it gets hot, that's chemical reaction takes place. Particulates are all year round. And there's a bunch of different sources as we discussed, but that we weren't reaching dangerous levels when we were under those EPA restrictions, but we also, I don't think we've significantly improved the particulate matter, the PM 2.5 or whatever that. That was the first thing I did when I started, was air quality. So
You sound like you're an
one
expert.
thing I can guarantee I know about. But to that, so we have significantly improved the ozone pollution size and the asthma and the breathing problems. We used to have, if you remember, the code red days where you said if you're over a certain age of asthma, don't go on the greenways, which was not a great thing to have to do. That has been a long time since we've had that part of the air quality issue. Particular matter remains something of an issue, however.
And one of the things that I did learn from DEQ, because again, in this state, DEQ is the lead agency, on that, but you know, just the valleys create a huge challenge, and you can have atmospheric inversions. So that concentrates the particulates, and that's the cost, I think, that we pay for living in this amazingly beautiful place. But the valleys, I don't know if that came out pretty loud, but that's definitely a significant factor, which we're not gonna be able to change.
Yes, that was one of the main drivers was the values.
I noticed you didn't mention Salem in any of your. I'm thinking, you know, being from Salem, you should have been number one ahead of Franklin County and Pontotoc and Holland. So, I mean, where do we fall in Salem?
So Salem kind of falls in the middle. It really depends on, on what indicators we're looking at. So it's kind of in the middle, and a lot of that does have to do with socioeconomic determinants of health or influences on health. I will tell you that our Salem Health Department is one of our busiest health departments. We're very happy to serve our population in Salem, and we have an amazing relationship with the first responders there. But there are disproportionate impacts. So if we look at things like sexually transmitted infections, substance use disorder, any urban center, any place that is typically has a higher burden of disease than suburban or rural areas. There are some differences, like we talked about transportation. One of the concerns, if we looked at Covington and Craig, the drunk driving death rates are markedly higher, and that's in part because of curvy roads, and in the city you can't speed that much because it's congested. And so that's like one of the areas where we look at disproportionate burden in the other direction. If that makes sense.
It does. Thank you.
Absolutely.
Dr. Moore, if I may,
Yeah.
just from a very comprehensive level, I'm interested in knowing about the reciprocal cooperation and communication between entities that I've been involved in that you've mentioned, CSBs, the schools, hospitals. You know, I can see that there are potential redundancies in those footprints. So is it your opinion that the health districts are an integral part of the inner workings of how we're addressing these issues? Or do you think that these entities are basically standalone in attacking these issues? I mean, I just think that there's a cross section, it appears to me.
Yeah, so there's something called Public Health 3.0, which is how we redefine what public health means. And in that newer definition, the local health departments are theoretically the chief health strategists in their communities. And our job is to work with everybody. So it is my job to work with healthcare delivery systems. It is my job to work with the CSBs. That's what our job is. The extent to which we are successful is dependent on a ton of variables. So here in the Roanoke Valley, we have an incredible relationship with Carillion. And certainly the Carillion facilities in other parts of Southwest Virginia are very involved in their assessment process and in the CHIP, the community health improvement process. So I would hope that no matter where you go in the state, your health department is anchoring those community coalitions, building those community coalitions. One of the reasons that I'm on the advisory board is because it's critical that the health department be there and be present in these major discussions. Different leadership in different places influences the success of those collaborations. And different, different cultures. So as an example, by definition, Brilliant has to provide community benefit. It's a not-for-profit hospital. Lewis Gale is a for-profit hospital, so the dynamics are extremely different for how engaged or not engaged they are. In Covington, Alleghany, we have a very, very close relationship with Lewis Gale Alleghany to provide those services. The CSB in Alleghany is unbelievable. And there are just a lot of factors. So I know I'm not answering your question correctly, but we do, and Penny certainly views her job as to build those bridges and to be as involved as possible in all of our community.
I have just, a softball question, be my last question.
Yeah.
In the work and the hats that many of us wear, as elected officials, our work does cross paths with, VDH as it pertains to, water, sewer, that type of thing. I know for us in Finland, it's been obvious to me on many occasions that we keep getting the same rhetoric, if you will, from Richmond, that the money's just not there, that you're under-resourced. And this is
a place.
so that's why I hesitate to ask. But I just, everything that you covered is so important to the health of our communities. It's so important that we've got access to data so that we know where we can do better. And so when we as elected officials hear things, and you hear it across the board with all state agencies, federal agencies, there's never enough money, there's never enough resources. But do we need to do more legislatively perhaps, to draw in more resources in the footprint of this commission, as it relates to health districts?
I mean, it's a hard question to ask because the competition for those taxpayer dollars is so extreme.
It is, yes.
For Roanoke, Alleghany Health Districts and for West Piedmont. What we public health have failed to do is focus on the ROI.
Yeah.
We're not really good at that. And that's one of the reasons why I was very intentional about this particular presentation. I think a lot of people think, oh, the health department can give vaccines. So, there's an outbreak, they'll investigate that. They don't. Talk about, we do car seats and safe sleep. The number one preventable cause of infant mortality is an unsafe sleep environment. We make sure that any woman who meets eligibility criteria for income has a free pack and play, a free sleep sack, because we know that if we prevent that one death, that one infant death, that person can become a productive member of society and give back to society. I mean, we do it because we don't want to prevent the death. Don't get me wrong. I mean, we want to prevent the death. Don't get me wrong. Like our goal is to improve health, but in doing so, we improve the economy. I'll give you a really concrete example. A lot of states have a match with USDA for WIC. WIC is USDA funded. A lot of states provide additional funding for WIC so that they can really optimize that ROI. Virginia is not one of them. I think that if we can make a better case that when we invest in this over the long run, home visitation, the ROI on home visitation, the incarceration rates drop dramatically and the job and the employment rates increase significantly with home visitation. So if we go back to this slide, just here in oh, sorry, I've lost it. Just in 1 year in CHIP, CHIP, so just 95% of children have insurance, and their parents end up increasing insurance. We know that that's going to be less trained on the safety net, which ultimately goes back to the taxpayer. I mean, ultimately, it all goes back to the taxpayer. Yes, and then this one, like 53% reduction in housing instability. I mean, that's amazing.
How does the home visitation work? Is it like once when the child's born? Is it a regular
So
meeting or?
the challenge is that not every home, so when I.
And do they have to ask it?
So here, there has to be a referral. Every state does it a little bit differently. So the ROI that I'm talking about is specifically for health, for a program, that it's called Nurse Family Partnership. There are only a couple places in Virginia that have NFP. Those are the data for that. They've been looking at the data for 35, 40 years. And they start, you have to be enrolled before your second trimester. And there are a lot of criteria, so it's not necessarily feasible for everybody. But they will follow from as early in the pregnancy as possible to age 2. CHIP of Roanoke Valley will start providing services as early as possible. There's also healthy families in our area. And the health department do baby care. And they'll go to age 5. It just depends on the program, the specific home visitation program, and the family's needs. So some families might get a home visitor that comes once a month. Some families might have a home visitor who comes every 2 weeks. It just depends on the program and on the family's needs.
And is it, the referral through like CPS or?
No, so it's not related to social services. We want to be proactive, and sometimes people, you could get a referral there, but in our ideal world, it's the healthcare providers and the community partners that are referring people to the home visitation program. So I talked about WIC, right? And I'm worried about time, but you guys, I'll finish on this one. So our WIC program, we serve thousands of women and children every year. The minute a woman becomes pregnant, we'll do a referral, because by definition, if they're eligible for WIC, they're going to be eligible for a home visitation program. And we'll do that referral, and that's where we start seeing the
So it's
ROI.
by qualifying for the WIC.
In ours, and for us, we would do it on, but birthing hospitals frequently do referrals right then. If there's not, if a family isn't enrolled yet in home visitation, the birthing hospital can enroll a family. So it can happen at any point, depending on the program, up to age 5. So I'm.
Dr. Morrow, thank you so very much. This has been so helpful to us, and commissioners, I've asked Mr. Holmes to make sure that we get a copy of this PowerPoint. I think it would be helpful for you to share with your constituency or any stakeholders that you have. And Dr. Morrow, I would ask is that if you all further develop your ROI analyses, maybe we have you back at an opportune time when things trend, and you have new data to offer. We would love to have you back.
Sure, anytime. And one of the things that I try to do is with all the localities we serve, is I do a state of the locality's health with the city manager or the county administrator. And I do something similar to this, but tailored to them. So if you are ever interested, should I tell them when my next go around, invite other people.
Well, thank you so
You're
much.
so welcome.
Thank
Thank
you.
you for having me. I
Yes.
appreciate it.
Are you going to
Okay.
stay
Or
or are you leaving?
it's up to,
You're welcome to
I'm
stay.
happy to
Be
stay.
back
That
up.
would be helpful.
I'd like to speak to you afterwards.
Sure, and then I will stay.
Okay, thank you all so much. Great presentation. The next item on our agenda, Mr. Holmes, I will ask you to introduce this issue with your staff.
Yeah, we're gonna have a presentation on the resolution to approve the rural work program by our still relatively new Director of Transportation,
Very new.
Chris Robinson.
All right, as we said, this is the rural transportation work program for this year. Am I advancing this? So a little background, it is required by federal code, planning process to address the transportation needs of non-metropolitan areas of the footprint of the commission. There is an 80% federal and a 20% local match for a total of 72,000 funding. This includes activities that are specific requests from VDOT, priorities identified by our regional stakeholders during our work program development. This year, the new projects that are going to show up in the work plan will be an update of the rural long-range transportation plan. It's a regular 5-year update. The bike route 76 update will be part of this plan, where we review an update for the 2017 bike route 76 plan is needed.
And inclusion of the regional trail and greenway counter program, and we research and test some new technologies supporting those programs. Any questions about this one?
Any questions?
I will just add one quick note, just to clarify, we do rural transportation work under a number of other programs like the Appalachian Regional Commission. Some things, even within, the TPO might impact rural transportation. So this isn't the comprehensive list of the rural transportation projects that you will maybe see in the work program that comes in June. This is just specifically what we program for the 58,000 that we get from VDOT for the state planning funds. So those are often layered with other funds. So I just want you, so that's not a lot of money to begin with, but there are other rural transportation activities that take place across other funding programs outside of the SPR funds.
Anybody, any commissioners have any questions? Hearing none, I believe that we need to approve via the resolution that's in your packet, the approval of this planning work program for 2026. So I'll entertain a motion.
I move.
Thank you, Barbara. Is there a second? Thank you. All those in favor, please say aye.
I,
All those opposed, like sign. Thank you. Thank you, Mr. Robertson. We appreciate it.
Thank you.
Okay, next on the agenda, I will turn to Mr. Holmes to introduce the electrical vehicle.
Andre Dolan is our Director of Transportation Demand Management. You've probably heard us reference the study a couple of times. I've been speaking to a lot of your boards and councils, and I've probably talked about this a little bit, so this was coming up. So this is a review of the study that we completed last fall, but this is the first time you're seeing a comprehensive review of the study.
Thank you so much. How we doing? Do we all need to like stand up and move for a minute? Are you gonna be with me? I mean, it is a hard, I can follow. Although I do have one slide that will just relate straight with what you were talking about. So good afternoon. Thank you, Madam Chair and board members. So yes, I'm going to just give you as quick as I can overview of the regional electric vehicle infrastructure strategy that we completed as for client request for last year. This we're gonna start with why we did this, and this is the slide I thought you'd be excited about because this was a work program request by one of our localities. However, we really thought that one, this plan really supports our regional sustainability goals, but because we have accounts for 28% on average of the national greenhouse gas emissions. So electric vehicles or electrification of corridors is a tool to reduce emissions coming from vehicles. And that's why we set out to do this. Our vision for the plan is to facilitate the adoption of a network of publicly accessible level 2 and DC, that's direct current fast chargers across the Roanoke region. That is the vision. The goals or the overarching goal is to provide guidance and support to all urban localities for their strategic EV infrastructure deployment, including planning, technical assistance, siting, so we're here to help you. We're providing a roadmap to get you there. The strategy roadmap. So I actually had a handout for you to take. This is really just our high level summary of this strategy. It is kind of has a step-by-step what this plan set out to do. You can have, it has our website, which is rvarc.org/EV plan. The plan can be downloaded there. All our tools are there accessible to you. just have it handy when you start thinking about this. This is a resource that you can get directly to it, as well as our planning, our mapping plan too. So again, this is just kind of a helpful visual. You can set it down, but when you're ready to think about it, maybe find it on a roll or just. So again, I'm gonna just quickly walk you through the plan, just so you know what's in there, and I'm really gonna try not to, bore you too much with it, but, we're gonna start with, just a quick EV charging infrastructure, high level overview and background. So the key concepts that you need to understand is what a charging station location is. So this is, this must be accessible to and visible to all drivers. Has to be located in a place that is accessible to the public. Ports are the power sources. They can be single or dual power sources. And the connectors are the plug types that vary by vehicle. And that's kind of important to know right now because they're not all standard. But again, that's explained in the plan, but just so you know that those are kind of like the three major components of a station. So our plan is set to provide strategies for implementation of level 2 chargers. These are like the chargers that are longer charge time, kind of designed to leave it and plug it and leave it in a location where the driver can just walk away and be gone for a little while. And then DC fast chargers, which are the short stay, high speed, that charges are more like the ones that you might see along the highway. So
Because you're trying to get to.
where, so how do we set, so how we set up our plan. So we started with existing conditions, understanding where we're at our region. And we did this work all regional for our footprint of the commission. When we set out to start the plan, at that time, as in 2022, there were 700 as of the end of 2022, and this data, in 2023, you don't have all the numbers. So at that time, there were 757 registered electric vehicles in the Roanoke region. Now, as of 2024, we have 1,351. So it's about 80% more than we had in 2022. But this is the data where we started with our plan. And as of 2024, we had 34 level 2 ports and 22 DC fast ports across our region. Okay, so the main thing we did on our main planning tool in this plan was to provide a roadmap for the localities to plan for future EV adoption. And so we forecasted 3 different scenarios for you to for this plan again. Our business as usual is low growth. Which is the trajectory of where that projection of how EV vehicles is being adopted in our region. Do not think just apply for. That is our business as usual, low growth strategy. Now there's a medium growth forecast that is kind of going along the business as usual trajectory, but applying some factors, and these are factors that are explained in the plan. That could amplify the growth of adoption. And then a high growth, which really assumes a very ambitious adoption. That is if like the region or the locality were to set really goals to meet maybe national, state or national standards that were set at that time. So you really have an aggressive strategy to grow. So those were the 3 scenarios we planned and we looked at. This is the visual representation of how those scenarios play out. And the dotted line for reference is the regional, light duty vehicle registration. So that's like all cars that are not EVs. So that's the trajectory of like how many cars they register annually in our region. Okay, this is regional numbers. And then we start with our low business as usual, our low growth down here at the bottom. And then our medium projections and our high trend projections. What this is telling us is that by 2030, in our region, we can see anywhere between 5,800 registrations to 66,000 if we were being very aggressive. But again, that's just projections, and that's what this data is telling us, and that hopefully will help you make decisions. This slide, I'm not gonna spend too much time, but this is really just telling you if we get there at level one, at strategy, business as usual, medium or high growth, how many actual stations do you need to supply that demand? But again, this is explain the plan, and if there's any questions or we want to spend more time on this, we can do that. Yeah, what else is in the plan? So we have the tools that you can use to begin your planning. Probably the most important tool is our map, our interactive map. And this interactive map is where you can see deciding, like assumptions that we're making for each of your region. Where will be the best location for your deployment of stations. And you can look, when you look at this map, again, the map is accessible on our website. That QR code in your handout takes you to the map. The map has, layers that you can turn on and off. But you can pick as an area that you want to look at, like which growth as an area you want to look at. You can zoom in into your region and look at the map. And what you're gonna look at once you zoom in into a region is, the aggregation is by parcels. So we got the parcel data from all of our localities. So a red parcel will indicate that that parcel has a high priority for installation of. Now, we're not looking at where in that parcel, or is that parcel private or public? That's gonna be the work that has to be done at the locality level once we're ready to look at that more directly. But that just gives you an idea where we're looking at. And then you can turn on all the proximity modifiers, and these are things we input into our prioritization, like location of recreational facilities, park and rides, bus stops, highway ramps, communities, minority communities, etc. We also set a chapter where we have the best practice for site, this is part of this tool, best practice for siting locations, based on your community needs and your community assets, transportation hubs, community sites, business and institutions, public lands, tourist destinations. And what will be kind of like the site characteristics that we're looking at. So this is just practicality, just getting into the weeds of how it select those specific sites. And this is important for jurisdictions that are interested in kind of having a little bit more fast or ambitious approach. There's the recommendation that you look at your ordinance and codes and look at maybe adopting some new strategies to facilitate the adoption of this infrastructure. Of course, it's infrastructure that needs to be planned. And sometimes if you have a new development, for instance, in Franklin County with a new development, if you think that this is going to be important, it's like, you put as part of your site development instructions to provide like the basic infrastructure so somebody else can come in and install DC fast charger. So those are, again, there are recommendations and best practices and case studies from other, just from across the country where you can learn, really almost copy paste what other people are doing if that is an interest of your locality. It's just more considerations we can take into account, but just know that it's there. And another thing we did is we have a whole chapter on engagement, on public engagement roadmap. So we know that this is, it requires talking to property owners, it requires talking to the community, it requires adoption of budgets and new laws. So we have a little bit of like a roadmap recommendation and who are the players who you need to invite to the table. Surveys, templates, et cetera, that we can help you with facilitating that public engagement part for your implementation. And again, I will say probably that's one of the key components where we can be helpful too, because we are adopting our public engagement strategies. We have better tools now, so that will be a big use.
Can you
for
go
our
back to the
partnership.
last slide? I'm sorry.
This?
Yeah. It seems to me that this is potentially the most important slide.
Oh, the one
Presentation.
that I like sent you over? All right.
Well,
Yeah.
you just kind of passed over it, but I mean, the missing piece of all of this, we don't do this kind of study for gas stations. Because we have that system and that delivery structure already set up. Most gas stations are privately owned. The community really doesn't have anything to do with whether there's a gas station there or not. So the assumption here is that the localities need to get involved in some way in encouraging some form of investment, either doing it themselves or encouraging private investors to go out and build these stations. Or the assumption is that the utility providers will, localities will have building or zoning building requirements that if you're gonna have multifamily or other types of facilities that you're building, that you have to include a certain amount of charging in that. So to me, this is what that slide starts to get at. And as I said, I mean, isn't that the key to this whole thing?
I mean, again, we have several tools in the plan, that's being one of them, of like guidelines of how, or just examples of how to get there, but you're right, yes. And even in the statewide approach, the point is to provide the initial seed funding for private developments, for private developers to develop, especially for the fast chargers. Those are the ones that are more expensive and harder to acquire and install. And yes, it requires private investment. I think that the levy formula was set up to do exactly that with the electrification of corridors, finding those partners. But yeah, and that is part of the engagement of the stakeholder engagement that needs to happen from the beginning to identify what is the way that, especially if you want to do the DC, the fast chargers. There's some more opportunities at a more localized level with the level 2, because they're, a little less expensive and easier to install. That you're correct.
Thank you.
So again, yeah, but here, the engagement support like dealerships, sometimes actually we have seen that and this with some examples and reach that we have been part of. Dealerships were very, very interested in being a key partner on receiving this funding that was coming from the government.
Yeah, well, I mean, I don't have an electric vehicle, but I had the experience of taking a trip in an electric vehicle, and it is not a casual undertaking.
Oh, it is. I know,
You have to know where the charging stations are, and they tend to be in either like in malls or large public places. Or Tesla has certain locations that they own, and that Tesla owners, have access to. I don't know if other people have.
yeah, so that's one of the key issues with the connectors I was mentioning. That's just kind of getting more into the weeds, but Tesla is proprietary. And it only works on Tesla. And then there has been an effort to like make things standard, hasn't gotten there yet.
I just got a Hyundai Kona electric vehicle. And what Hyundai is doing is they have the CCS port, but now they've made their own proprietary connector that takes you from the CCS port to the Tesla port. So that now you can use all the Tesla ones, and it seems that Tesla is becoming more and more of the standard and.
Yeah, that was the goal, at least when we were working on this, that's what the conversation was, to get those, because they're the most available, to get it to be standard. I did have an anecdote too, I rented I was stuck in Miami for a flight being delayed, and we rented an EV, and I was like, let's just see what is this all about, and it was eye-opening, because not only it was more expensive to rent than and this is Miami, when you think that this is such a big city, it's more expensive to rent than a regular vehicle. And then you have to bring it recharged to where, you know how you get a car, gas car, and it's like the car has to be with the gas that you, so it's the same policy. But I actually should have known better, but by the time I found a station, and it was a level 2 station, it would have taken me like 5 hours to charge it to where I was supposed to drop it off.
Yeah.
And I did not have 5 hours, so I just dropped it off, and we just thought, hopefully we don't get charged. We didn't get charged locally.
I don't think time is money is really true when you know electric vehicles.
Yeah, so
Crazy.
it's still, it's definitely, I think I'll get that on my closing remarks, but, we're almost to the end. So funding, I would say there's a whole chapter on like what was current at the time of funding, you know, this is probably the most, take it with a grain of salt at this particular moment. It's specifically coming from the National Vehicle Infrastructure Formula Program, that was a Navy program that was set out to fund the electrification of all our highways across the nation. That program is currently paused for review. And that program was money that was coming into the state through VDOT. So again, that program is paused for review at this moment. However, through our partner, I mean, probably the most important regional partner in this is Virginia Clean Cities. They are kind of the clearinghouse for all the funding and programs that are for funding. And they have one particular funding, Rural Reimagine. Actually, Alleghany, Covington, and Clifton Forge are recipients of this grant, and it provides level 2 chargers and not cost to the locality. The only cost that they have to incur, well, they have to go through a contract process, but the only cost they have to incur is the installation. So provided, and they provide the local support and the technical assistance to identify that siting, the specific siting, and whatever is needed. And so I believe like those localities are right now through the process, working with the contractor to install this charger. So that's still available, that's ongoing, like you can just apply anytime. And there's a couple more programs, most of them, like as you can see, are like either closed for application or on review. But I was told also the alternative fuel infrastructure tax credit, so that is a tax credit from used for those major installations, so like a dealership or something that you install, then you get a tax credit. That is still in the law and still available. I would just say the best, you know, again, I'm just telling you what the plan is about and what we're here to support you. So when we get there, we'll all be different. So let's just stay in communication though. Yeah, just wanted to mention, probably the best resource right now for all of us is this, the RVARC.org/EV plan. Again, the plan can be downloaded there. Our resources can be downloaded there. The map can be accessed there. And if you have, if and when your locality is ready to look at this in more detail, just please make sure. But I wanted to let you know it's done, it's ready, and it's there. I will say the other reason that this was important is if and when federal authorization for funding like this becomes available again, they're usually required, for any federal program, they're gonna ask you to have a plan. Before you apply for money, they wanna see your plan. So we have the plan. We just gotta sit down.
Are they gonna be local plans or regional plans or
This
statewide?
is so for the state level formula program, it was a state level plan that that was the Navy plan, that every state had to complete, and they had a deadline, it was got to be completed by 2023, I believe. And to receive the funding, and that was with the goal to electrify all the major highways, right? So when we were looking at that, that was the anticipation we did, that we took into account. At some point, they're gonna be looking at the 220s and like the local road, right? The 220s, the 419s, the 311s. So are they gonna require a plan then? So we anticipate, in anticipation of that, we decided to create a regional plan. So everyone is ready now. Was it gonna be a local plan? I don't know, but right now we have a regional plan that can be used for planning, for planning. Funding, yeah. That makes sense.
Any other questions for Andrea?
And thank you for being so active.
Andrea, thank you so much. This has been very informative and it's just another example of how
Something's
proactive.
done, it's.
Yeah, I
You
haven't,
probably won't hear me.
yeah, thank you very, very
I'll
much.
have something else to report next.
Thank you. Okay, super.
And then I didn't come.
Okay, so we're gonna move on. I think we just have one committee report from Mr. Hill this afternoon.
Thank you, Madam Chair, and members of the commission. I will be brief, but the crux of this report is we've had a lot of meetings and we're having a few more meetings leading up to the ultimate adoption of the SES document at your June 26th meeting. So on last Wednesday and next Friday, our SES subcommittee update, subcommittee, I'll get there right in a second, met and will meet again to recommend a few major structural things of the SWOT analysis, the vision, goals, and strategies, and the performance measures to the full committee that will meet virtually on May 7th. And at that point, they'll get a look at the draft and can provide comments. And then on the 14th, we'll have a field trip meeting at Roanoke Cement Company, and at that point, we anticipate the recommendation of the SES documents to you all for your June meeting. And just as a note on that, Roanoke Cement will provide us a tour and a presentation on a very groundbreaking first ever facility, and forgive me, I'm not a scientist here, but calcined clay is a high performing type of cement. It's the first facility that will be built apparently in the world. It's a $132 million project that a large investment on the part of Roanoke Cement and the Department of Energy. And so we're going to be hearing about the project, and we'll be hearing about and seeing about that project in the years to come as they tell us, folks from all over the world will be coming to see the project and how to replicate. And so this is going to be a really exciting meeting. So that is the extent of my updates.
Any questions?
Were you saying that the whole commission is going to that, or just the SES committee?
That's the Comprehensive Economic Development Strategy
Committee, okay. So you're gonna share with us what you experienced.
Absolutely. We'll even take photos.
Any other questions for Brian? Thank you so much.
Sure, thank you.
Appreciate it very, very much. Are there any other committee information pieces, Mr. Holmes? Okay. Next item is any other business that you all would like to bring before the commission. Do you all have any requests for other business topics? Mr. Holmes?
Well, ma'am.
Okay.
And then I can after make comments.
Yeah, that's what we're gonna move to right now, Barbara, comments from commissioners. And I would just predicate this piece on our agenda to just remind you that if you have any questions for Ms. Sheffield, please feel free to ask them during this period of time or after the meeting. So Barbara, did you have some comments to make?
I can't wait to talk to Ms. Morrow and Ms. Sheffield. I'd like to do that privately, but I want to celebrate that they did ribbon cutting on the Cambria Amtrak station today. So that's wonderful. And if you go there, that you will be seeing Bike Route 76 signs. And these are the Bike Route 76 signs that, here we go. And that, we're celebrating the 250 of our country. That Bike Route 76 Bike Centennial was ridden first in 1976 to celebrate the 200th birthday of our country. And energy is surrounding the 250 and the riding of our bikes across country again. This is in Virginia, we are encouraging the state to go from to Yorktown to go all the way to the Atlantic Ocean, because when we have international cyclists come from all over the world, they want to go to coast, and the York River just doesn't cut it. So we're working on that. We're also at a disadvantage because the cross-country rides anymore are starting in Georgetown and Washington, D.C., taking the C&O towpath to Cumberland, Maryland, taking the Greater Allegheny Passage to Pittsburgh, and somehow getting over to the Katy Trail. We need to connect. I go by Barbara Dirk Connect now, and I really think that we need to connect our neighborhoods, our communities, and our Commonwealth. That we have the Capital Trail that goes from Williamsburg to Richmond. We're working on the fall line that will get us up to Ashland, but we need to get to Charlottesville to Lexington to Roanoke, and then forward. That the 250 is, when I was there in Williamsburg the other day, they said America made in Virginia. And that's, you look at the history, that's what it says, America made in Virginia. The cyclists that are going across country are missing Virginia because they're taking these shared use paths. Virginia Tech is working on some podcasts to talk about the 76 route through here, which is exciting. And that May is Bike Month. And Virginia helped me print off a few Bike Month. Governor Youngkin declared May as Bike Month, and you can only have 6 proposals, 6 whereases on here. And so we did not get added the whereas Roanoke is the National Mountain Bike Championships, but we're going to get that on next year. So take back to your localities that May is Bike Month. I urge you to have one day that you designate to walk, bike, or bus to work.
Barbara, thank you so much. Your advocacy is extraordinary.
And I will see you at the CTV meeting, and hopefully you can include bicycling as part of your legislative agenda.
Thank you, Barbara. Any other comments from commissioners? Hearing none, I'll entertain a motion to adjourn.
Madam Chair, I move to adjourn.
I knew that was coming. All those in favor, please say aye. All right, thank you guys for your time.
If I can keep the work program committee members, we will have an abbreviated meeting. And let you guys go. Yeah. Thank you so much.